Here at Milan, um, we do things a little bit differently than the status quo, but we try to celebrate that. We see the beauty and the goodness in sometimes doing things a little bit differently because our goal is to always stay ahead of the curve, to always try to do things the way that best practices and research says things should be done. Not necessarily the way things have always been done, but we try to do things the right way. Here at Milan, there's been a little bit of a debate about one of the quote-unquote right ways to do things. Um, we use the analogy a lot of times. It's called the chicken or the egg paradox in education. You know the old saying, "What came first, the chicken or the egg?" The debate about which one should come first. In schools, the debate plays out which comes first, the assessment or the instruction, or the test or the instruction. The old way of doing things, the traditional way of doing things would be a teacher would instruct or teach lessons for a week, 2 weeks, 3 weeks at a time. At the end of all of that instruction, they would sit back one night and think about all the stuff that they taught and generate some sort of test based off of all the stuff they taught and give the kids a test. The test would measure whether or not the kids retained all the information that was taught. Here in Milan, we actually flip that around. Here in Milan, instead of instructing to assess, we believe it's important to assess in order to instruct. Assessment should come before instruction. Now, on the surface, those of us that are used to the traditional way, we look at that and we say, well, that's different, that's weird, that's wrong. Let me give you a simple little analogy as to why we think it works here, why it works at Milan Middle School, aside from the data and the evidence that we're seeing. Why does it make sense? Think about going to the doctors. A lot of us make regular trips to the doctor. Maybe we go once a year for a checkup, for example. You go to the doctor for a checkup, and what does the doctor do? The first thing the doctor does is he or she might sit down and talk to you and just ask how you're doing. Then they take some measurements. They might take your blood pressure. They might measure your pulse. They might measure your weight or your height or your flexibility or draw some blood. Bottom line is they run some baseline tests just to see how you're doing. Based on the results from those tests, they might say, okay, you're good. All of your measurements came back normal. Normal meaning they meet the standard or the baseline, if you will. But if something is abnormal, if something is off of the baseline, they might order more tests until they can come to some sort of determination as to why things aren't quite measuring up. Only after they're satisfied that they have a diagnosis, after they've run all the tests that they can possibly run and they've pinpointed where your quote-unquote deficiencies are, then they diagnose some sort of treatment plan, whether it's medicine or exercise or whatever the case may be. It's at that point that they say, let's do some things about what we measured in the test. If you think about it, what the doctors are doing is they're testing you before they decide on the treatment. They're determining how you perform according to a standard based off of where you are. They go back and they possibly order more tests, and then they say, now let's change some things to try to get you closer to the standard, closer to that benchmark. Why is it that in schools we don't do things the same way? Why is it in schools that we think it's important to go and treat you and give you all kinds of medicine first, and then after the fact, we'll run the tests to see how you did? Well, what if you were already at the standard? Did you need to take all that medicine? Did you need to get the treatment if you were already there? Or what if things were so far off the chart that the medicine we were giving you wasn't the appropriate medicine? It's not fair to treat every single illness with the same treatment. We're not going to give every single person penicillin. We're not going to give every single person aspirin when they go to the doctor. Depending on what your ailments are, you receive different treatments. It's the same approach in schools, or at least it should be the same approach in schools. That's the approach we use here in Milan. We assess first. We know the outcome we're looking for. We know what the standard is. So we assess at the very beginning and say, now where are you according to the standard? Where are you according to the benchmark, according to the norms? If you're already where you should be, awesome. We're not going to provide you treatment. And we might give you some strategies and say, here's how you can get even healthier. Here's some things you can do to go above and beyond, if you will. But if you're already there, we're not going to give you the same medicine, if you will, the same treatment, the same instruction that somebody else might get. Depending on where people's weaknesses are, depending on where their deficiencies are, they're going to receive different instruction. So here in Milan, you'll notice that students are assessed at the very beginning of an instructional unit. And yeah, it's possible that kids can, according to their grades, receive full credit before the teacher has even taught a single thing. Well, that's fair, because they've already got it. Is it a punishment for the kids that aren't there yet? Absolutely not. They receive a grade that shows where they are at the very beginning, and that's fine. It's an accurate reflection of what they know. But then the teacher can sit down and treat their diagnosis, if you will. They can determine where they are and where they aren't, according to the standard, and provide the necessary interventions to get them there. So here in Milan, although it might seem counterintuitive because it's different than what we're used to, assessment comes before instruction, not the other way around.